Welcome to the 9th Pharmacy Technician Symposium, Changing Landscapes in the Digital Age, the Pharmacy Support Workforce as part of the solution towards universal health coverage. My name is Susan James. I am the chair for the Strategic Platform for Pharmacy Technicians with FIP and chair of the Pharmacy Technician Advisory Committee, who are pleased to be hosting this symposium for you today. Before we begin, and we have several people that are here to provide some welcoming comments for our symposium, I do want to first say Happy World Pharmacy Technician Day. What an exciting opportunity for us to be able to be hosting this 9th symposium of FIP's pharmacy technician efforts, along with World Pharmacy Technician Day. Thank you so much to all of our pharmacy technicians, other support workers by all of the different names that you are working under for the contributions that you are making to the pharmacy effort. Just like and along with pharmacists, you have been stepping up certainly in the last period of time during the COVID to demonstrate the contributions that you're able to make in providing those services to patients around the world to aid in this COVID-19 time and recovery that is needed. As I said, it is the Pharmacy Technician Advisory Committee through the platform that is hosting today's session, and we are delighted to do so. Before we share a few comments about what you are going to experience over the session today, along with 2 other sessions that we are hosting tomorrow as a part of the symposium, I would like to welcome some of the individuals from FIP that have words of welcome for you as well. I'm going to start with Dominique Jordan. Dominique is the president of FIP, and he has some comments for you to welcome and open today's symposium. Dominique?
Thank you very much, Suzanne. Dear colleagues, it is my pleasure to welcome you to the Global Pharmacy Technician Symposium. This year, the theme, Changing Landscape in the Digital Age, the pharmacy support workforce as part of the solution toward universal health coverage, can't be more appropriate. What we have learned from this pandemic is that it can only be defeated globally. Collaboration between countries, between different stakeholders is crucial to find the appropriate solution to stop the pandemic. The joint effort of science, practice, and education were necessary to provide service providers with the knowledge, tools, vaccines, and medicines to help the population. The second lesson we learned during this pandemic is that without a competent workforce, it is not possible for practitioners to fulfill their mission, namely to play an important role in delivering primary health care. With the support of our technicians, and I experience this every day in my pharmacy, it is possible for pharmacists to cope with the work overload that we have been experiencing for more than a year and a half. I want to thank you all for your precious collaboration, allowing pharmacists to develop and implement new services like vaccination and testing. Despite the pandemic, FIP continued to work to support the effort of its members to move the profession forwards according to the different needs of countries in accordance with one FIP strategy. After signing the Astana Declaration in 2018, FIP developed new tools that we launched during 2020 and 2021, like the FIP Development Goals, the FIP Global Observatory, FIP Workforce Initiative in collaboration with WHO, and different reports that you can download from our website. The other part of your symposium will deal with new technologies. This is also an important part of our strategy in FIP, which can count on the support of our technology forum and the report that has just been launched. Pharmacists have always been at the forefront of the use of new technologies by integrating developments into their daily practice. leadership, technologies, workforce development, all important topics which are part of one FIP strategy. To conclude, I want to thank all the people involved in the organization of this symposium. I wish everybody interesting sessions, and despite the pandemic, but thanks to technology, we can profit of shared experiences and reflect on the future roles of technicians all over the globe. Enjoy your day. Thank you very much.
Thank you so much, Dominique, for those words. I now would like to introduce Catherine Duggan. Unfortunately, she is not able to be with us. Catherine is the CEO of FIP. And although unable to be here in person today, she certainly wanted to share her comments, and we do have the following words from her. We'll listen to those now.
Good morning, good evening, good afternoon to everybody, wherever you are in the world, and welcome to those who may be listening in after the event. It's a delight for us to be able to host the symposium today and tomorrow, 19th and 20th of October, the 9th FIP Global Pharmacy Technician Symposium for 2021. The title of this is Changing Landscapes in the Digital Age, the Pharmacy Support Workforce as Part of the Solution towards Universal Health Coverage. And as you know, we signed up to the Astana Declaration on behalf of the entire profession, demonstrating the place that pharmacy, pharmacists, pharmaceutical scientists, pharmacy technicians, pharmacy educators play in delivering universal health coverage through primary healthcare. Never before did we think this was going to come to fruition. In our wildest dreams, we did not believe that COVID would have such an impact on the year that followed. But indeed, the digital age is upon us, and all the advances that we have seen, good and forced upon us, have really pushed us into working in different ways. I'm super sorry I can't be with you today at the opening ceremony. I promise you I will listen in afterwards, but I wanted to send my words of support, championship, advocacy, and pride. It's really important for us to recognise all of the contributions of the entire pharmacy workforce in our profession. And without pharmacy technicians, we know that frontline pharmacy would not have been able to deliver and continue to deliver for everybody in all our communities, in all of our societies, in all of our nations during the past 19 months. It's with great pride that I see that this symposium goes from strength to strength, and we look forward to the findings from today. The digital age keeps us in touch while we cannot meet face to face. And I'd be really excited to hear your feedback on how we could use that to good effect in the years to come. Even when we can meet face to face, what is the position and the place of digital? Can we use it to enhance our meetings? Can we use it to keep in touch? Can we use it to avoid travel while we all sit in the middle of a climate crisis as well? With COP26 fast approaching, I think that's also an important consideration, which I know my technician colleagues will give due care and attention. Thanks a million to the FIP team. Thanks so much to all of our Bureau colleagues who support this symposium and the work of the PTAC. And thanks particularly to Susan and Marwan for the great work that you've been leading and stewarding with all our technician leaders and colleagues globally. Have a great symposium. Welcome, take care, and I'll be in touch soon. Bye for now.
So nice to hear Catherine, and I know that she absolutely would have liked to be with us today, but we appreciate those words. And finally, from the leadership of FIP, I would like to introduce Ian Bates. Ian has been very important to our pharmacy technician efforts at FIP. He is the director of the Global Pharmacy Observatory, as well as the director of the Workforce Development Hub, where the pharmacy technician effort really had its early development, its beginnings back in 2012, and Ian has provided constant leadership and I guess just support for the work of pharmacy technicians in that regard. So Ian, over to you for some words. Thanks.
Thank you for that introduction, Susan. I feel very humble. I didn't realize I'd been doing all those things, but thank you very much indeed. It's been a joint effort, is the point I'm making. And this whole project is, it's very close to me, and it's very close to my, the missions we have in FIP about the pharmaceutical workforce, the pharmacy family, if you like. There is no healthcare without a workforce. Workforce comes first, and healthcare follows on from that. And it's evident that if we want to improve healthcare, then we should start by paying attention to our workforce. And our pharmacy workforce is very broad in its representation, and all parts of that workforce are equally important to the provision of healthcare, particularly in primary healthcare environments. But we have some significant global challenges to the provision of pharmaceutical healthcare. These challenges cut across all income levels, across all cultures, and are defined really by increasing complexity, the increasing complexity of populations living longer, and those populations living longer with more comorbidities. And we're living longer, which is a good thing, but we're living longer with more comorbidities, and we're taking more medicines for them. So it is becoming increasingly complex to try and meet those healthcare needs. Our typical patients in hospitals are elderly and frail, with their comorbid disease being sometimes treated sequentially, one by one. Our patients in community primary healthcare settings have maybe a whole host of pharmaceutical issues, as well as there's social issues as well. We cannot begin to tackle these challenges without acknowledging that we need a diverse, capable and adaptable workforce, which includes everybody. We're all equally responsible for the healthcare that we provide. And one of our missions in FIP is to ensure that we all have equitable access to workforce development and continued training and continued development. And this is the work of the Workforce Development Hub and the Global Pharmaceutical Observatory, working together with the boards and with our newer structures, such as the Pharmacy Technicians Advisory Committee that Susan alluded to in her opening comments. So this particular project is getting larger, gaining more momentum, and gaining more visibility. And it's a real pleasure to be able to talk to you all at the start of this important and significant conference that you're having together. In 2016, FIP launched the Workforce Development Goals in Nanjing. And FIP made it quite clear at the launch of this, of that global innovation, that the pharmaceutical workforce includes everybody, including our scientists as well. They're part of our pharmaceutical workforce, as are, of course, yourselves. So, since the success of launching those workforce development goals and the evidence and outcomes which is coming from having them as a focus for the first time, FIP has taken the bold step of redeveloping them into global development goals. So ensuring that we are now linking up workforce and workforce development with new services and new ways of delivering pharmaceutical care, and new ways of reaching out into communities to help with prevention and health education, and ensuring that everybody has equitable access to medicines expertise. We cannot have the FIP Global Development Goals without acknowledging the actual diversity of our pharmaceutical workforce. And this is one of the ways in which we can do that, is by hosting important events such as this one today, chaired by Susan. So this conference has particular importance, certainly for me, because of the work that's gone into getting here, but much more importantly, has particular importance for our global mission with FIP, which is to ensure that we advance our education and practice, that we advance our workforce, and we advance our science, all directed towards better treatment and better access to medicines for our respective populations. That's a pretty big mission, and it somehow sounds as though, you know, it's just too big to do that globally. But I can assure you it's not too big. And by having you here today on this conference, we are actually achieving parts of that global mission. So you're already all contributing towards that, which is great. And I feel very privileged and proud to be asked to address you all for a few minutes at the start of this important conference. So Susan, thank you very much for allowing me 5 minutes here to talk to you. I'm going to step out of the way now so that you can get on with the important business of doing business. Thank you very much indeed.
Thank you so much, Ian. I'd also like to just thank, along with the leadership that have spoken to you today, and acknowledge some of what Ian has just spoken about. A thank you very much to FIP for the true recognition and inclusion of the pharmacy technician and support workforce, recognizing that it is absolutely an important component of the pharmaceutical workforce. And FIP has continued to allow opportunities and platforms for this important member of the workforce to contribute and to continue to advance the efforts of this group. As I said, we are hosted for the symposium is being hosted by the Pharmacy Technician Advisory Committee. I would like to just make a comment about that to let people know that this is a group that officially started in 2019 and was a small group of individuals, about 10 to 12 individuals that were coming together prepared to take on the work to advance beyond what we had been doing in terms of a symposium every year with the Congress into a number of other initiatives and projects that we wanted to look at in order to advance the workforce even further and to integrate within FIP further. We now have well over 30 individuals that are members of the Pharmacy Advisory Committee, Pharmacy Technician Advisory Committee. We have representation from over 20 countries at this time, and those individuals are pharmacists and pharmacy technicians and other support workers. Important to note that we really do believe in that integration and coming together, the collaboration, the partnership that is the pharmaceutical workforce. I'd like to let people know that it is not difficult to join the advisory committee. If you have a passion towards this work and the advancement of the workforce, all members of FIP are welcome to put their name forward for participation on the advisory committee. Our work is growing and we need to continue to grow our workforce within FIP to be able to develop the kinds of tools and resources that pharmacy technicians and pharmacists are looking for, make sure that this workforce is fully understood, that it is coming from a place of sound education We have practice, tools, resources, and understanding of those roles, and a contribution to science. All of those things are important, and it is from this space that we are now contributing more and more within FIP. Our work is designed into working groups, and so there is opportunity for individuals to contribute in a number of different ways. We have been hosting digital events. We have the symposium that you are now participating in. We have other very specific projects, resources, publications. We've just published a commentary that we are excited about. We have a web page, which we have great plans to continue to grow, and no doubt will become something more of a microsite over time, where there will be multiple opportunities to network, connect with others, and to find those resources that are developed from this group, as well as FIP in general and other resources that are available worldwide through our various networks. So an opportunity to participate extended to all of you if you are interested, and there will be information certainly available in that regard. Today, though, we are launching this year's symposium. And in fact, we started that with the last session. I don't know how many people were able to join us, but we kicked off our symposium with the Development Goal 8 Working with Others session, and had a great opportunity to hear about all of the different ways that pharmacy is working with others, both within the profession and with other members of the healthcare team. And throughout that recognition that the pharmacy support and pharmacy technician workforce is absolutely a component of it. Over the next couple hours, we are going to hear about leadership within the pharmacy technician world. You have a wonderful group of individuals that are going to share the work that they are doing, the roles that they are in that demonstrate leadership from all sorts of different places and perspectives. And so that will begin very shortly. We also do have 2 more sessions tomorrow that are a part of the symposium. I note that you do need to register for those separately, so please make sure that you have done that. Know that they will also be available if you're unable to attend. You will be able to watch them later. We are very excited. You've been hearing, and of course our theme is about digital health. So tomorrow we do have a session that is specifically talking about digital health. Again, an opportunity to understand what's going on in FIP in this regard, as well as some of the different work and roles that pharmacy technicians are taking on in this space. And then tomorrow, after that session, we will be wrapping up with a very interesting session on optimizing the pharmacy support workforce and understanding unique pharmacy technicians' roles, things that you didn't know pharmacy technicians do. Again, a great group of individuals who are going to share some very different and interesting aspects of their work within the pharmacy workforce. So with that, I am not going to keep us back from the session that is ahead. Again, welcome to everybody. I would also like to just acknowledge all of our moderators for the sessions that are about to begin, each and every one of the speakers. Also, a particular thank you to those individuals who have assisted in developing today's and tomorrow's symposium sessions. In particular, Ryan Burke, who has been coordinating the symposium on behalf of the advisory committee with the assistance of Kathy Schuster and Pat Hall, many other members of the pharmacy technician advisory committee who have been assisting in identifying some of the speakers worldwide. And with that, I am going to hand this session over to the moderators for our next leadership session. Thank you, everyone. Enjoy the symposium. We will be talking with you again at the end, and absolutely welcome your comments, your feedback throughout this session and our other sessions. Provide us with your questions. We will try to address those, and most importantly, your feedback. What more can we do? What work would you like to see that will be most helpful in advancing yourselves and your workforce wherever you are? Thanks so much, and enjoy the next session. Over to you, Zach.
All right, great. Thanks, everyone. Hello, everyone, and welcome to the FIP Pharmacy Technician Symposium session on leadership and pharmacy technician workforce development. I am Zachary Green, and I am honored to welcome you to today's session. A strong pharmacy support workforce is a key component of FIP's workforce development initiatives. This session will explore leadership roles and opportunities for pharmacy technicians and highlight strategies for further developing the pharmacy technician workforce. I'll be co-moderating this session alongside Liz Fidler. Liz has worked across various sectors of pharmacy and is a leader in driving forward pharmacy technician development. Liz has led the development of a new pharmacy technician qualification and chaired the review of the National Occupation Standards. While Association Pharmacy Technician UK Education Officer, Liz led the development of the APT UK Foundation Pharmacy Framework and Resources, and her current role of Associate Dean Quality for Health Education England, working across Kent, Surrey, and Sussex. She is responsible for leading the development and implementation of quality and management and enhancement functions. Working in partnership with heads of school, trainees, professional regulators, NHS England, and NHS Improvement to support that the clinical learning environment is a safe and effective place to undertake education. Previously, Liz held the post as Health Education England, London and Southeast, Interim Pharmacy Dean and Associate Head of Pharmacy, where she was responsible for leading and supporting pharmacy workforce development and education across the region. Liz was honored to receive an Association of Pharmacy Technicians UK Fellowship and to win the APT UK AAH Pharmacy Technician of the Year Outstanding Contribution in 2017. Liz also is currently serving as the president of APT UK.
Thank you, Zach. And if I may, just before I introduce Zach, I would just like to say thank you so much. It's hugely inspiring to be joining colleagues across the globe on World Pharmacy Technician Day. To be here on the 9th Symposium just shows how far the profession continues to thrive and the opportunities that have been provided us during the pandemic to ensure that we can really utilise our knowledge and skills and expertise. I just want to take a quick moment to thank every colleague on this symposium today for making the time to join and share and listen. I think there is great strength in us coming together across the globe to be able to share our experiences and learn from each other. And it's fantastic to be able to do this in a digital platform, because I know for sure I would not be able to participate today without fully capitalising on these technologies. So I really hope that you enjoy what the rest of the session, and there is much learning, and the lineup of speakers today are truly inspiring. I'd like now to take the honour of introducing the other my colleague, Zachary Green, who will be moderating today's session with me. So Zachary Green is a PTCB certified pharmacy technician since 2008 and currently serves as the Associate Director of Partnership Development at PTCB. In this role, he manages accounts for PTCB's pharmacy technician educator and employer programs and assists with various activities surrounding PTCB stakeholder relationships. Prior to joining PTCB in 2013, Zachary worked in the field as a pharmacy technician at Mount Carmel West Hospital in Columbus. He earned his BA in Public Affairs with research distinction and a minor in Public Health at The Ohio State University. Thank you, Zach.
Thank you, Liz. Just some announcements for today. The webinar is being recorded and live streamed via YouTube. This recording will be available on the website at www.fip.org. You may ask questions. Please submit your questions using the Q&A function in Zoom. And you're welcome to provide feedback to webinars@fip.org. And you can become a member of FIP at that web address there. So today, this is just our agenda. We did the introductions. First up, we'll have Collaborative Leadership in Global Context by Jill Martin Boone. Then we'll have The Role of Pharmacy Technician in Developing Sustainable Health Partnerships Collaboration in Global Health Crisis by Kate Thorndike. Then we'll have FIP Development Goals and the Pharmacy Technician Workforce presented by Abigail Tan. And finally, Equity in the Workplace presented by Vibhuti Arya. We'll have some time for questions from you all in the audience, and then finally wrap up and final remarks for this session. And here is what you can expect to learn during today's event. Our first speaker for this session is Jill Martin Boone. Jill E. Martin Boone is a professor of pharmacy practice at the James L. Winkle College of Pharmacy, University of Cincinnati, with a recent focus on chronic pain management and practice-based outcomes research. Prior to her current role, Dr. Boone practiced in both inpatient and ambulatory clinical pharmacy practice and transplantation, and served as the Director of Transplant Outcomes at the University Hospital, where she has extensive involvement in outcomes management, assessing resource utilization and quality of life measurements for over 15 years. She's been active on many local, state, national, and international committees addressing pharmacy quality and outcomes issues. She's been recognized for sustained contributions to hospital pharmacy practice with the Ohio Society of Health System Pharmacists Walter A. Frazier Award. Dr. Boone is a past president of American Society of Health System Pharmacists, past co-chair of the International Pharmaceutical Federation Working Group on Collaborative Practice, and currently FIP Domain co-lead for interprofessional education. And Jill, I will advance through your slides for you. So if you could just let me know when to advance, but I'm turning this over to you now.
Thank you, Zach, and thank you so much for allowing me to participate today. In particular, on this very exciting, and I celebrate with you. And Zach, if you could pop to the next slide on this Pharmacy Technician Day. So I celebrate with you, and congratulations, and just both accomplishments that have been made as well as accomplishments yet to be made. So just a quick overview on the next slide is that today we are going to have just a few minutes of background introduction. Then I'm going to talk a little bit about the healthcare pharmacy practice landscape, and then talk a bit about some of the leadership lessons that I have learned and observed through my career. So as we know, we have had an explosion in the number of therapies and medical technologies over the last century that's requiring healthcare professionals to practice at the very top of their game. And in many cases, the training is becoming more sophisticated. So I know for sure with pharmacy and pharmacy technicians, we have all experienced the need for continued growth in our training. We also have a global healthcare shortage. And so again, this is all coming together that we need to work very collaboratively to provide the best care that we can for our patients. Next slide, please. So when I look at pharmacy, we have the pharmacy enterprise that includes a number of people, and I'm going to focus today on pharmacy technicians and pharmacists, especially as Zach mentioned, I've worked very much with the development goal 8, working with others and for FIP, and it's not only interprofessional, but it's intraprofessional, making sure that we are working well together in order to advance quality care. So when I look at the changes in training, the changes in the responsibilities of pharmacy through my career over several decades, we've constantly been growing and meeting the needs of an expanded number of medications, expanded complex of care. And I see the same thing happening with pharmacy technician advancement, both in regards to training as well as responsibility. And we're having to tailor our efforts to what the needs are out there, the changing supply of resources, as well as the demand in care. So in order to be at our best game, we have to work well together within pharmacy, as well as united when we're working with collaboratively with other professionals. So on the next slide, I was interested in a recent study with technicians that said that 74% of the study participants said that their role as a technician has expanded during their career. So really just affirmed this constant change. And 48% of the participants felt like they are not even being fully utilized at the appropriate level of responsibility. And 60% feel that they have have not had the opportunity to fill leadership roles. So I wanted to just again parallel what through my career in pharmacy practice, I've observed this from early until now, that this is always a challenge, and we consistently and continually need to grow to make those pieces fit together in regards to both the training, the expertise, and the change. So how is it that the profession sees the roles? That continues to affirm the fact. This is a recent forecast panel from ASHP, and one of the questions related to technicians was, what's the future roles of technicians? And this is not a surprise. I'm preaching to the choir here. This is not a surprise that over 75% or over 80% of people believe that pharmacy technicians are going to continue to be advancing responsibilities within healthcare systems. So what do we need to continue to work together to make this happen? And that is continued focus on leadership. You know, I want to congratulate the group within FIP now, this advisory group, as well as just so much that's happened to acknowledge the expertise and the roles that technicians play throughout the world. And it has taken a great deal of leadership and partnership to get to where we are today. But going forward, we're going to need even more. And so what I'd like to do is just highlight what I mean by the definition of leadership. And that is the art of motivating a group of people to act toward achieving a common goal or influence. And I specifically highlight that this is the definition I want to use because it may involve a position of authority, but it does not have to involve a position of authority. It is influence, and all of us have a role to play. All of us have a sphere of influence, and you as an individual, regardless of whether or not you may have considered yourself as a leader, have a major role in regards to moving your profession forward, being a representative of your profession, partnering with other people within the pharmacy enterprise, as well as other professionals to represent the role of pharmacy broadly. So throughout my career, I've had both good and maybe unsuccessful experiences with making successful changes. And I wanted to just offer a few examples or key strategies that I've observed that have been successful and important. And I note collaborative because, as we've talked about, collaboration is the future. It's the present, but certainly is going to continue to be the future. And so even learning to lead in a collaborative effort is very critical. So my three keys, the first one is to be your best. Now that seems probably very logical, and you might say, you know, why would you bring this to the forefront as a number one key? Well, did you know that the way that you behave, that the contributions that you make are the number one impact on your credibility? So as a pharmacy professional, as a pharmacy technician, as a pharmacist, it is critical that you bring your A game every day to your profession. So being at the top of your credentials or pursuing the top of your credentials, to be the best in regards to your contributions, identifying where your best fit is on a daily basis, being early, being engaged, being alert. All of those are very basic, but they speak highly to your credibility in moving forward where we need to go for best patient outcomes. So number one is be your very best. Number two is then really, after you've brought in your A game, is being very aware of the people that you're working with, the other pharmacy technicians, the pharmacists, the other team members, making sure that you are aware of the people that are there. So there's two ways that you can really focus to learn your team in order to be influential in moving your profession forward. First of all is listening. And when I say listen, what exactly do I mean? So next slide, Zach. So listening means one more. Asking questions, paying attention, and listening intently for not only the words, but the meanings of the words. Okay, keep going. Listening for ideas, emotions, feelings, what's not being said, keeping an open mind, listening more than you talk, and hearing the other person out, and lastly, avoiding any type of prejudgment. So why would I say really listening is important? Well, when I have been a part of a team, I've recognized that listening has made a big difference in my effectiveness to participate, my effectiveness to impact patient care, but also becoming part of that team. So as I listen and I interpret and engage what's happening as a part of that healthcare team, I, as a pharmacy professional, am able to better understand where I can provide my expertise. So number one is bringing your game. Number two is really learning your team. And then lastly is observing. So same concept, but just observing the dynamics, observing where you can provide your expertise most effectively. So moving on to key number 3, really incorporates then serving your team. Now, I am a big advocate of servant leadership, and servant leadership is being a servant first. It begins with the natural feeling that one wants to serve first, then conscious choice brings one to aspire to lead. That person is sharply different from one who is a leader first. So really looking again at the needs of your patient, looking at the team composition, and bringing what you can in a serving manner. John Maxwell is one of my favorite leaders who says, people may hear your words, but they feel your attitude. And Zig Ziglar says, true joy comes from when you inspire, encourage, or guide someone else on a path. I want to pause here just for a minute because, you know, we are all in a place to influence those around us. And if you think for a moment, those that have influenced you, in many cases, you have felt their caring. You have felt, in addition to needing to be an expert, you have felt the excellence that they have brought, but you've also felt the caring attitude. So being your best, learning your team, and then serving your team in the most effective manner. These things bring leadership together and move your pharmacy technician role forward. Once you have established that credibility, your team becomes very much aware of the expertise that you bring, and it allows you to even provide more services within the healthcare system. Next slide. Finally, how did you define your success? Did you achieve your goal? Did you cross the finish line together with your team? Is the patient's impact been made as a whole? When you can move forward together and make a difference for patients, that is success. So as a leader, in the next slide, a leader is best when people barely know that he or she exists. When his work is done, his aim fulfilled, they will say, we did it ourselves. So as a leader, we are all ready and prepared. Again, I want to congratulate the Pharmacy Technician Global Celebration today, and so many great things that have already been done to get us here. So I guess today, for those of you that are in leadership actions already, I just challenge you to continue your great work. And for those of you who maybe need to give it some thought to move forward, your future depends on what you do today. So start. Thank you.
Thank you very much, Jill. Next, we have Kate Thorndike. Kate Thorndike works as a specialist transplant pharmacy technician in the Cambridge Transplant Unit at Addenbrooke's Hospital. Kate's role involves supporting transplant patients to understand the importance of their new complex drug regimens, identifying individual barriers, and developing medication adherence strategies. Kate also volunteers with the Cambridge Global Health Partnerships and is currently part of the Kampala Cambridge multidisciplinary team. She has just finished a Master's of Science in Global Health and plans to use her research to further develop cross-cultural partnership collaboration. And Kate, same, I will advance the slides for you. So if you could just let me know when to advance the slides. And for the audience, just a side note, we'll take, if you have any questions for the individual speakers, we'll gather those if you submit them through the question and answer box, and then we'll have time at the end after all the speakers have completed.
Thank you, Zach. Can you see me?
Yep. Yeah, we see you.
Oh, sorry. Hi, everyone. Thanks for that introduction. I just wanted to talk to you a little bit today. I've been doing some research over the last year and I'm involved in a health partnership. So I wanted to talk to you about my role in the health partnership. This is just a list of some of the organisations I'm involved in, but I'll cover those as we go along. So next slide, please. So the Commonwealth Partnerships for Antimicrobial Stewardship, we call it CwPAMS for short, is an initiative that was set up by the Commonwealth Pharmacists Association, and that's been funded by the Department for Health and Social Care. This is an initiative that's 12 health partnerships across 4 Commonwealth countries, including Ghana, Tanzania, Uganda, and Zambia, and obviously the UK as well. And these are teams of multidisciplinary teams of health professionals from across those countries working together to tackle the growing challenge of global antimicrobial resistance. And the main aim for our partnerships is really to strengthen the global health workforce and any partner institutions such as universities to really tackle this challenge together. We know that the global workforce shortage doesn't just affect vulnerable health systems in low and middle income countries, it affects all countries worldwide. Here in the UK, the NHS relies heavily on our overseas workforce, so it has huge implications for all of us. I've included some photos as we go along of our health partnership. This is myself, Emma Williams, who is a paediatric pharmacist here at Addenbrooke's, and Reem Santos, who's an antimicrobial pharmacist. This is us teaching together at Malago Hospital in Uganda. Next slide, please. So I've learned a lot about global health and partnerships over the last 2 years as I've been studying and been involved in one. But I think one of the key things for me is that partnership is really at the heart of global health. The only way we could possibly bridge the gap in the health inequalities that we know exist between the world's richest and poorest countries is really through a genuine sharing of skills, ideas, and knowledge. And global health partnerships present a unique opportunity for healthcare professionals, also for educators and researchers to come together and to collaborate and share resources, all with a common goal to improve population health. And equality is central to our health partnerships. We're a diverse and inclusive network of health professionals. There isn't any hierarchy within our teams. Everyone is equally valued as we collectively experience different contexts and challenges, such as different health systems, a different set of resources and infrastructure. This is just a picture of our team together in CwPAMS General Hospital. Next slide, please. I think working in a wider multidisciplinary team such as a health partnership has given me a much deeper understanding of how we can impart skills and learn from one another. It's also really shown me how different cultures, worldviews, and limited resources can have such an impact on the wider global health population. And health professionals working in low and middle income settings are expert in their settings. Just sadly, they lack access to ongoing research and educational opportunities, also sufficient resources and infrastructure that really supports the standard of practice they aspire to. And as healthcare professionals from high-income countries, we are truly privileged to be highly trained and have access to digital technology. But we're inexperienced, and I want to say naive, to the local challenges in low and middle income settings, and that can really make our interventions ineffective and unsustainable. Next slide, please. We met as a health partnership in 2019. Our partners from Cambridge went out to Kampala, and in November, our Ugandan partners came over to Cambridge. But obviously in March 2020, COVID struck, and it's really been shaping the landscape for our health partnership collaboration, just due to the social and travel restrictions. And it's really plunged partners into thinking through new strategies for implementing long-term sustainable interventions to help us to continue developing our collaboration cross-culturally. And whilst COVID-19 has impacted our health partnership quite negatively in lots of ways, it's also provided a novel opportunity for us as partners to reflect and start to consider our partnership dynamics and any innovative development opportunities that it presents. This is a picture of Christine Moody, our infection control nurse, with some of our Ugandan nurses. Next slide, please. So this really led me to doing my research and looking into cross-cultural health partnerships and their role in informing bidirectional, so two-way learning in low and middle income settings. It sounds quite long-winded, but basically we know that health professionals are really likely to experience and interpret cross-cultural health partnerships in different ways. So this research really aimed to explore the experiences and knowledge of those health professionals, particularly in the context of the CwPAMS partnership, to see how this can inform future online learning. And I really believe that by engaging our partners in the development of this platform, it will really encourage progress to move beyond the independent learning outcomes such as personal and professional development. We know that's high on the objectives for health professionals who volunteer within partnerships, and that's a really good thing, but actually we want to move beyond that and to look at new skills such as sourcing innovations and capturing ideas from low and middle income settings that really inspire us in our approach to health service delivery. This is me and a friend of mine, Ronald, who's a pharmacist in Uganda. Next slide, please. So for my research methodology, I did a comprehensive literature review and some primary research. So I designed an online survey questionnaire and sent that out to all the health professionals who've been involved in the CwPAMS programme. I could only unfortunately send it to the UK-based health professionals because due to time restrictions and resources, I couldn't get ethics approval in sub-Saharan Africa. So that was a real limitation of this research. However, the diversity of health professionals' job roles was really essential to this research, and I was able to obtain that. It's essential because I want this platform to be accessible to multidisciplinary teams, not just to doctors or not just to pharmacists, but to pharmacy technicians as well, and a whole range of health professionals. This is just a picture of our partners together in Kampala. Next slide, please. So the uptake for my survey was quite limited, unfortunately. My target audience were healthcare professionals on the front line of the COVID pandemic. So trying to get them to fill in an online survey was quite a big ask, actually, which is understandable. But considering that, I did get some good data. So the main findings really, we found that respondents held a high regard for the core components of collaboration. So things like mutual learning, shared objectives, things that are really essential to an effective health partnership. And our respondents also demonstrated an understanding of bidirectional partnership approaches. So this two-way learning and teaching. And that's so important to make it equal and sustainable. And the survey findings, but more so the wider literature, has emphasised the priority for efforts towards research collaboration between high-income countries and low and middle-income countries. So trying to incorporate that into the design of our online platform. Next slide, please. one of the findings that I was particularly excited about is this concept called reverse innovation. So this is a concept which acknowledges that high-income countries must explore in equal measure what can be learnt from a health system in a low and middle income setting. This is so important. As health professionals from high-income countries, research shows that we often go to impart skills and knowledge, but there is this misconception that we don't have anything to learn from a low and middle income setting. And that's so true and untrue. And reverse innovation really turns that on its head. It says it moves us beyond the skills of our own individual competences as health professionals and moves us towards making changes in practice and being more resourceful within our own settings. And this was really a really good finding. Most of the respondents reported learning skills to make alcohol hand gel whilst they were out in Uganda from raw materials. And as the first phase of the pandemic hit over in the UK, health professionals were able to share with their colleagues that actually if there was a national shortage of alcohol hand gel, they now had the skills to make it from raw materials. So Ronald is just showing us how that's done in that photo. Next slide, please. So what's next for me? Sharing my research with the wider global health community is really important. And I'd love to do some scoping research in sub-Saharan Africa to replicate this online survey and to then compare the response from our partners from both sides of our partnership. And trying to build up a network now to expand the scope of this project. This was just a little bit of research for my master's dissertation, but I'd love to see it get bigger and develop more. And I'd love to lead on forming a working group to try and develop more ideas and resources. I bring a lot of passion and vision for an online platform within our partnership, but I certainly don't have the skills to implement an online platform. So we need a team to do that. And then developing the platform so that if there's any other future health emergencies, we already have this in place so our partnership collaboration is sustainable. Next slide, please. And that's just my contact information if you'd like to get in touch. Thanks so much for listening.
Thank you so much, Kate. It's fantastic to see leadership in action there and the great passion and drive that you've built into that particular piece of research and the future proposals, which I'm sure there are many colleagues watching now who might be quite excitedly thinking about how they can support in terms of next steps through FIP's goals and the project you're speaking of. To continue with seeing leadership in action from pharmacy technicians from across the globe, I'm delighted to introduce our next speaker, Abigail Tan. Abigail has been working as a pharmacy technician since 2013 at KK Women's and Children's Hospital. Currently, Abigail is in charge of managing the over-the-counter items, training staff on medication reconciliation, and also planning of continuous education amongst the pharmacy technicians. Abigail is interested in leadership roles and workforce development of pharmacy technicians. As our roles evolve, there are many opportunities to create platforms that require pharmacy technician leaders to take charge and impact the workforce development within the pharmacy community. As such, Abigail participates in FIP's PTAC and in Singapore, a representative in a pharmacy technicians leaders group. This group was created to introduce leadership to the ground and have discussed topics from attrition rate to career development initiatives. Over to you, Abigail.
Hello, thank you, Jill, for the amazing introduction. Hi, thank you, everyone. Thank you for coming. I'm from Singapore, and I'll be talking about leadership roles and opportunities here in Singapore and why this area of development is important for pharmacy technicians. So I've been a pharmacy technician for the past 8 years in the emergency pharmacy, and I'd like to talk more about the initiatives that we have. Next, please. So today's learning objectives are to identify some of the development goals that are related to developing the pharmacy support workforce. And I'll be showing you the career development pathways for us in Singapore, followed by some of the initiatives that we've come up with. And lastly, the strategies that we've adopted for the professional development of pharmacy technicians. Next, please. So these are some of the development goals that I felt was related to the pharmacy support workforce. However, I'll be focusing on 4. So the first would be competency development. So it talks about clear and accessible developmental frameworks. In Singapore, we have competency frameworks that serve as a guideline for graduating pharmacy technicians, and I will talk more about them later. Under DG6, leadership development, we have several initiatives that we have started that opens up leadership development opportunities for pharmacy technicians. And next, for continuing education, it's an in-practice and needs-based continuing professional development and continuing education linked to career development pathways and practice frameworks. And lastly, next, digital health. So with the up-and-coming role of technology, digital health seems like an important thing to talk about. Systems and structures in place to develop and deliver quality digital health and pharmaceutical care services. In Singapore, such initiatives help streamline certain processes. So I'll talk about those later as well. This is the current pharmacy technician's career development pathway. So this was taken from the Pharmacy Career Development Framework 2014 for Public Healthcare Institutions, Ministry of Health, Singapore. In Singapore, our pharmacy technicians are not registered. However, there are 3 ways to become a qualified pharmacy technician. So the first is through a 3-year diploma program in pharmaceutical sciences, where students get to choose between 2 specializations, between patient practice or industrial. Next is through a pharmacy technician conversion program that's run by the Pharmaceutical Society of Singapore. It's about a year's long, yeah. And last would be someone with a degree in pharmacy, however, it's unrecognized in Singapore. So, previous slide, please. So a fresh grad would start their career, as you can see, at the bottom of the arrow, as a pharmacy technician grade 2. It usually stops around as a senior pharmacy technician. However, further career expansion can be achieved through attaining an advanced diploma in pharmaceutical sciences, where progression into being a pharmacy technician executive is possible. Next, please. Thank you. This is the competency framework under the National Competency Standards. So this is to serve as a benchmark standards to public health institutions for developing in-house on-the-job training programs and competency assessment assessment for existing and newly recruited pharmacy technicians at entry level. You can see on the image on the left that there are 7 competency domains. This is taken from the Pharmacy Technicians Entry to Practice Competency Standards, Ministry of Health. So this serves as a national standard of entry-level pharmacy technicians. It's also an entry to practice assessment framework where it is conducted during their final year of internship. Next, please. These are the available professional development strategies for pharmacy technicians. This ensures continued stakeholder engagements throughout the entire journey, from institutional policy development through implementation, developing leaders among pharmacy technicians, and offering choices for pharmacy technicians to upskill. So these are the 3 areas. It's not widely practiced, but for continuing education, at least for my hospital, we have it as an annual requirement as part of our learning and growth. We also have something called the Department Learning Plan, where we identify other learning needs such as critical thinking or supervisory skills. And under the national programs, we have the Advanced Diploma, where they can choose to take a full 4 post-diploma certificate, which would span about 1.5 years, or they can choose to take a single post-diploma certificate should they choose to focus on one area. Next, please. I'd like to touch a little bit on digital health and how this relates to developing the pharmacy support workforce. So the definition of digital health includes diverse categories of products comprising telehealth and telemedicine, mobile health, wearable devices, health information technologies, and personalized medicine. Under telepharmacy, in certain community settings, pharmacy technicians are trained to conduct telecounseling to patients, and this allows and creates more roles for pharmacy technicians to expand into. Under automation, this gives us the ability to streamline inventory, picking and packing processes, reducing human packing errors, and allowing us more time for patient care. Next, please. So why do we need to develop leadership roles among pharmacy technicians? So being able to engage with the pharmacy support workforce promotes empowerment, opens opportunities for upscaling, role expansion, being seen as a role model to the support workforce, and career progression for pharmacy technicians. There are 3 areas where we can develop leadership roles and opportunities for pharmacy technicians. So in the context of Singapore, within the workplace, we have the advanced diploma, which allows career expansion. We also allow pharmacy technicians to be in charge of various areas in the pharmacy, such as operations, inventory, training and development, automation, and medication safety. Under work groups and focus groups, it could be in or out of the hospital setting. So at an institutional level, we have the hospital's pharmacy technicians work group, which I will share about that later. On a national level, we have the Chief Pharmacist Pharmacy Technician Leaders Group, and we also have the Training and Development Committee. And lastly, at international level would be FIP's PTAC. We are also thinking of creating a committee of practice for pharmacy technicians at the moment. Next, please. So this is the National Pharmacy Technician Leaders Group. This was established in October of 2019. This group was brought together by the Chief Pharmacist at the Ministry of Health to introduce leadership to the ground. Pharmacy technician representatives were nominated by their own pharmacy managers to form this group. So this is what we have discussed since the establishment. We've discussed the purpose of this PTL meeting platform, the challenges faced due to high attrition rate and burnout, national pharmacy strategy initiatives, pharmacy technicians entry to practice assessment framework, and we discussed the SWOT analysis on the evolving roles of pharmacy technicians in Singapore. Next, please. And through this, as I am a representative of the Pharmacy Technician Leaders Group. Even though I was representing my hospital, I felt the need to listen to my peers and to really put my ears closer to the ground. And so discussing with my bosses and my supervisors, we decided to come out with the hospital's Pharmacy Technicians Work Group. So this is a group of pharmacy technicians from the various areas of the hospital: outpatient, inpatient, laboratory, outpatient services, medication safety, and administration. So the need for this work group was really great because I really wanted to create a more holistic feedback platform, as opposed to getting opinions that were just, within my section or my peers or just by myself. I didn't feel like it should just be my voice, even though I am the representative, and it was really important for me to be able to advocate for them. So within this group, we've discussed about the National Pharmacy Strategy initiatives as well. We've discussed some of the discussions that were discussed in the leaders group and how it can be applied to the hospital. Sectional feedback and how we can improve on them. Pharmacy technicians career development framework, and also on the community of practice for pharmacy technicians. Thank you.
Thank you very much, Abigail. It's really interesting to take a moment to pause and reflect on all of the different education and career pathways and where there's commonality across countries, but also where there may be some gaps and some opportunity for some shared learning. Thank you very much, Abigail.
Thank you.
I'll now move on to introduce our next speaker, Dr. Vibhuti Arya. Vibhuti Arya is a professor at St. John's University College of Pharmacy and Health Sciences and serves as a clinical advisor to the New York City Department of Health and Mental Hygiene. She works to integrate pharmacists into public health initiatives, particularly among high-risk, medically underserved areas in New York City, and advises on legislation pertinent to pharmacy practice and access to care. She is also a member of the Health Department's Institutional Review Board and serves as a global lead for equity workforce development for the International Pharmaceutical Federation, FIP. Dr. Arya uses her experiences in health, theatre, and as a yoga teacher to deepen conversations around racial justice for individuals and systems working towards changing their culture towards sustainable change. Dr. Arya completed the Pharmaceutical Care Leadership Residency at the University of Minnesota and at MPH from the Johns Hopkins Bloomberg School of Public Health. Over to you. Thank you.
Thank you so kindly. Really an honor to be here among such a wonderful panel, and I appreciate the opportunity to speak a little bit about equity in the workforce, and very specifically celebrating our pharmacy technicians as a backbone of our pharmacy operations. I'll share with you a little bit of some stories and sort of see this as an opportunity for us to wrap up a little bit of the key messages that we've already heard today from our previous speakers. I am a global lead for the FIP development goal number 10, which deals with equity and equality. And I hope to shed a little bit of light in terms of how we can all sort of integrate these themes of leadership and policy and legislation, and really think about how we can maximize the functionality of our teams in the pharmacy. On the next slide, I'm going to share with you a little bit of a story about teamwork and working together. Since my start as an intern at a community pharmacy, independent pharmacy, so not a chain or it was owned by, mom and pop shop type of thing, and a wonderful experience that I had that made me fall in love with independent pharmacy, with community pharmacy, really was about the way in which our technicians, our pharmacy technicians, embraced me as an intern and then as a licensed pharmacist. The way that I think about the story is really not where I think it was an eye-opener in different ways for me to realize the hierarchies that exist within our pharmacy work systems, and how our health systems and our systems in general and organizations enable all of us to be our best in our leadership positions. As an intern, when I came in, I had an amazing opportunity to work with a team of pharmacy technicians who had been practicing in that pharmacy for quite some time. And when I walked in there, I would ask lots of questions because they had a lot more historical knowledge, institutional knowledge, and operational knowledge about what they were doing in the pharmacy, but also about our communities that we served. I had only been there a month or so. And so in learning from them, I really came to recognize how vital our team was, and pharmacy technicians very specifically, in terms of really bridging the gaps between ourselves and the community and what the community needs were. And as a person who's had her career focused around health equity and social justice, I really appreciated that lens, because it really reminded us that what we're there to do is serve our patients and not just dispense medications, and sort of, we can get caught up in the operations of it all, but it really centered the people that we were serving in our day-to-day work. When I became a licensed pharmacist, during the time I was doing my residency in Minnesota, I live in New York, so it was a very different environment for me. I remember also a similar story where I went into the pharmacy, and frankly, and I celebrate and I say this to them all the time, I'm extremely grateful for the technicians who paved the way for me to function better as a pharmacist. I think a lot of times we expect pharmacists to come in there and sort of know what they're doing and take and assume a leadership role, not recognizing that the people who are behind it all, the pharmacy technicians who've been there day in and day out and serve our patients as well, sometimes may not get the recognition that they frankly deserve. And so I was really grateful. And in asking lots of questions, I remember there being a little bit of a surprise from the technicians when I sort of followed their lead, so to speak. And what I understood from that conversation was that while pharmacy technicians, in my experience, were instrumental to my experience as a pharmacist, I think that what was surprising to me is that they felt that they were allowed to step into leadership. And I questioned why the question about allowing. And I said, well, you've been here longer, so obviously you know about this pharmacy and the patients that we serve a lot longer than frankly I do. And I think that what I learned from that story and that experience was that not all the time we recognize that sometimes these hierarchies can create power differentials. And it's really important for us to understand how we perform and what our responsibility is in that organization to create an environment, frankly, that makes everybody feel welcomed and everybody feel invited to make decisions no matter where they are in that leadership where they are in those leadership roles. On the next slide, what I would like to call our attention to next, Zach, is really thinking about how our teams collectively light the fire within. And what I want to bring your attention to here is that although doing the work of seeing our patients and bringing equity and racial justice to the conversation can be very individual, in that we need to recognize where we are in our own biases, where we are and what we're doing in our organizations to fulfill the role that we have and the responsibility that we have as healthcare professionals. Sometimes we tend to see things individually a little too much. And rather than thinking about it as an individual effort, we really need to understand what it is to function as a team and as a collective. And I think, Jill, in your talking about servant leadership, it really resonated, because what we are asked to do is to keep the end user in mind, right? So to keep the patient in mind, that we are running operations for people and not just for metrics. And it's really easy for us to get caught up in the operation, but really important for us to understand what it is that the interconnectedness brings us. I think the pandemic certainly has taught us that. Having one part of the world vaccinated is not enough, that we need equitable efforts for global vaccination. We need equitable efforts when it comes to understanding public health emergency and preparedness and response. But it's really important for us to understand how we show up as part of that collective, that we may not think of us as interconnected all the time, but we really are. And so I'd like to bring your attention to thinking about it as a beehive mentality, where all of us have to work together for that collective. And, I often remind those of us who specifically do work in health equity day in and day out that equity is not just the language of the oppressed. It's the human language, and it's the human experience, where it really impacts all of us when we think about our, again, interconnectedness and how we show up in this world. On the next slide, I'd like to talk a little bit about how leadership can actually take place in some of our pharmacy settings. And I loved hearing Kate's ideas from the research, and really this kind of being a steward of cross-cultural care and what that means, and bringing humility. Jill, you talked a lot about servant leadership and what it really takes in some of those lessons to bring our best selves forward. And Abigail, in your recognition about your voice as a technician, but also representing the group, and really centering, again, I think what all of you did was center humility and center people as you were talking. One of the things that I was very conscious of in any pharmacy I've worked in, and now in academia, hierarchies will create power differentials, right? And what that means really is that when we know people have what we call positional leadership, so while all of us have leadership and agency within our own rights, there are positions of leadership where we find ourselves, and people who have those positions of leadership, it's really important for all of us to understand not only, again, how we show up as an individual, but also how we show up in that position, what responsibility we have. And sometimes what that means is that it requires us to use our privilege in that position of leadership to really take a step back. And what that means is that sometimes we are called to make decisions. Sometimes we are called to show up in the world. But sometimes we are called to take a step back and have, as my colleague Claire Thompson says, have that light shed on others, shine that light on excellence. And what that means is that sometimes it's not us, right? Many times it's not us. And part of being a leader and that servant leader requires us to take a step back and really understand how it is that we're maximizing those of us who we impact with, and that we're maximizing our teams and how they operate. It requires us to embrace humility. And the reason I put leading without permission is that a lot of times, as I've learned in my own experience, people sometimes can wait because there are other positions of leadership, people who are in those positions who feel that it's important to allow for leadership to occur, for people to allow others to make decisions. And what I'd like to bring our attention to is that all of us have the agency, and all of us have the privilege to step into our own leadership. And that menacing sort of tiger face is to remind us that all of us have that, but those who are in positions of leadership have to shape the environment and the culture so that we can embrace humility. And that's actually, it's celebrated for others to provide their opinions, for others to bring their ideas forward. And usually that's what drives a lot of policy and change, that we don't need permission for others to tell us that it's okay, but sometimes we just have to find the courage and that menacing tiger within us to actually go out there and do that. And I want to say that this is not just about celebrating technicians as champions and bridges for the community, but also really to focus on equity within our own workforce, with our colleagues, and checking those power and privilege and hierarchies that we tend to sometimes create and perpetuate within our own work environments. This also brings us sort of the idea of understanding, you know, how do we deal with training and with professional development? Training and opportunities are for the people, right? It's for our team. So we ought to be asking questions about what the individual's goals are. And to quote one of my favorite, and I think many other favorite TV shows, Ted Lasso, you know, a good mentor hopes you will move on. A great mentor knows you will. And so in the spirit of servant leadership and embracing that humility, it's really important for us to recognize how we can actually empower not only ourselves, but step back and allow opportunities to actually help people within our teams thrive, not just for the metrics and the goals that we're trying to meet on paper, but really also showing kindness and paving the way for modeling that leadership in a very humble way. On the next slide, you'll see that, of course, everybody loves pandas, right? And so what's important for us to understand is that it's about us creating systems that are resilient and nimble enough so that they're welcoming and inviting innovation in all of the leaders, right? And so the pharmacy technicians I've been fortunate to work with have done that everywhere I have worked, and really bringing out leadership from their own ideas and innovation that frankly helped everybody in the pharmacy succeed, including our patients, that this was safer for them and it was better for them in terms of getting their information and knowledge that they needed. It's important for us to understand that when we're thinking about equity in the workforce, that we're actually bringing out the inner leader. And while sometimes we think about pandas as these cute, fuzzy, sort of kind animals, as my 7-year-old daughter likes to remind me, all animals are kind, but they have a ferocious side when they want to. For pandas, it's when their bamboo feels threatened, right? When they're threatened that somebody's about to take their bamboo. So really, it's up to us to ensure that we are nurturing leadership skills, not just those in who we see who are extroverted leaders who are speaking up and sharing their ideas, but that we are practicing a lot of kindness and an equitable, towards an equitable future. What that means is for us to embrace humility. It means to take responsibility of our own part and truly understanding how we can behave more like a beehive mentality, where it's truly important at the end of the day for the collective to thrive in order for us to create a more sustainable and equitable future. So I thank you, and I thank all the techs that I've always had the pleasure to work with, and I celebrate your kindness and your service to our patients. Thank you.
Thank you so much, Vibhuti. I think I definitely like the take-home message around leading without permission. I think that's a really empowering statement, particularly as pharmacy technicians, we can take away to start to think about in terms of our own practice. We've heard from a real range of speakers this afternoon, and I would really encourage colleagues to make the most of the expertise that we have on this call. So please do take some time to pop some questions into the Q&A box, and we'll make sure that we can get as much of the expertise and knowledge from these fantastic speakers to answer some of your questions. I know the pharmacy family is not quiet, so in order to encourage you to start with some questions, I'm going to hand over to my colleague Zach, first of all, to ask some questions of our first speakers.
Sure, thanks, Liz. We did receive a question in the question and answer function regarding pharmacy technicians in other countries, such as South Africa, study or do CPD in Singapore through online learning. So do any of the panelists feel like they could address cross-training across countries? I think that might be a better question amongst peers. So if anybody in the audience has input, go ahead and type some information in the chat function. And then our next question is specifically for Abigail. Could you please elaborate on community of practice? What sort of methods does Singapore have in mind?
So right now we are in the midst of discussing the creation of a community of practice. So basically, a community of practice is where you get a group of like-minded individuals with common issues or common ideas about an area of practice. So that's what we're trying to do. We're trying to recruit as many pharmacy technicians as possible, for them to come together and we start a discussion, and then we can move forward from there to really zoom in on what they really want to talk about, and then we'll start there with various topics of interest, if you will. Yeah.
Thank you. And then the last question here submitted through the Q&A section is, what is the entry qualification to be trained as a pharmacy technician? How long does it take to be trained as a pharmacy technician? So I think that answer varies really within country of practice, but do any of the panelists want to speak on the entry qualifications in your area?
So I know, this is Vibhuti, I know that in several different countries, there's some recognized certifications that pharmacy technicians can take to essentially improve their career prospects and really think about how they can get ahead in terms of getting the training and having the skills necessary to perform some extra task. I know this varies country by country, but I think that what's important also might be, I'm going to tie in one of our attendees, Allison, had talked about recruiting as well. And I think this sort of ties in a little bit, is that the entry qualifications are one thing, and then the other thing to think about is how you're thinking about the career trajectory, for example, and talking to others in terms of where you actually want to go and what are some skills you want to gain. One of the things that I like to remind people is that sometimes we look at the available jobs and we say, okay, maybe we want to do that. And what does it take for me to do that? Another thing I think for us to think about is that as the scope of pharmacists and pharmacy technicians continues to evolve and change, it's really important for us to also think about ways in which we can add on to some gaps that we recognize in health systems and in pharmacy workforce. So what are the gaps that are currently there? How can I fulfill that? And what do I need in terms of skills and certifications, et cetera, for me to fulfill that gap, which might be take a little bit more work in terms of understanding, but it's really important to understand what the certifications that are nationally recognized, but also where those gaps are, so you can add some more skills to be able to then reach there. And I think the other thing is to, if I may, for Allison's comment as well, and I think this ties in with what Jill was also mentioning, is that sometimes it's really important for us also to not just recruit. I think you mentioned in the traditional way, where I think sometimes we focus a lot on compliance and conformity, and it's really important for us to invite innovation and people who can add to our teams rather than who look very similar or sound very similar or already adding to sort of what already exists. So it's really important for us to have that lens where we can think about additional things and sort of a diverse viewpoint and opinion and an innovative work style that we can add to our teams so that our teams and everybody in them succeed.
Yeah, Vibhuti, if I may add, from a UK perspective, we have regulation. And so therefore for England, Scotland and Wales in particular, we have a baseline entry qualification, which means that all of our pre-registration trainee pharmacy technicians reach the point of registration having met the standard suite of learning outcomes. So there's a very clear baseline in terms of which you can build upon. So again, just reflecting on the comments of colleagues on the call on the webinar today, I think it's really important that we as professionals also challenge job descriptions and ask the key questions and really push ourselves forward as a profession in terms of what we are able to do. I think often as a profession, we sometimes do feel a bit kind of oppressed in terms of not necessarily applying for jobs that actually we were perfectly have the skills base and knowledge to execute, but it's perhaps because employers in the system aren't aware that we are in a position to be able to do that. So I like the term about education rather than alienation, and often just having that conversation about, actually, I've looked at the role specification here, and I feel I do, through all the additional opportunities that I may have sought through my career, opportunities to develop in other ways, actually, I feel that I could fulfill this role requirement. I may just not hold a pharmacist qualification, but what is it that that role requires that requires it to be a pharmacist and perhaps not a pharmacy technician? But having the confidence to have those conversations, I think, is something that we all, perhaps as part of the development in terms of leadership, need to be enabling. And again, I think that's why your comment around leading without permission really resonated with me. How do we grow our leaders to feel comfortable with constructive challenge and not feel that that's a something that can be negative?
Mm-hmm. And if I may just, oh, sorry, go ahead, Jill.
That's okay. I was going to say, I just wanted to also add on in regards to the US specifically, there is a national pharmacy technician certification process, but the regulations are also state driven. And so requiring those or adopting those are specific to states. Most states have adopted that type of requirement, but there are additional credentials, much like Liz was just alluding to, for specific activities. So what I had kind of highlighted in regards to both your experience and your expertise, and in some cases your additional credentials, pushing forward for being a model expert and as a pharmacy technician, really kind of aligned with the fact that this is a changing process. And even within the United States, again, because it's state driven, there's slightly different bars for different states.
And thank you for adding that. I think the one thing that reminded me of is also Liz's comment, is that a lot of time, I think, Liz, and this is where it kind of resonated again, was that whole idea about waiting and about sort of driving change and what that means. I also, want to recognize that a lot of the times the certifications and the education and training opportunities come from, the US, UK, Australia, these countries where we tend to assume a lot of things and are frankly unaware of the cultural patterns and realities of other countries. And so one of the things that I'm very sort of conscious of all the time is asking questions about what the assumptions are that we're making and encouraging people to speak up and question the status quo. A lot of times, it's a simple question. It says, oh, what about this aspect? Or why haven't we talked about this aspect? Or even language concerns, or the way that we do things, what the sort of baseline is, or the reference point is. I think it's really important for folks to speak up and say, that may work in this context, but in this context, it needs to be changed. How do we tap into FIP? And Abigail so aptly mentioned that there are workforce development goals that are working towards these frameworks and these competence frameworks. And I'd really encourage you all to tap into that, to have situational awareness of what already exists. And again, scan for those gaps that, we are a few people trying to do a lot of things, but our lenses are limited and our time and bandwidth are limited. And we'd love to hear more about your ideas, but also how we can be better and smarter about including, not only just including, but really driving change when it comes to pharmacy technicians and sort of practicing to their maximum capacity and talent. So don't ever be afraid to ask questions. I used to think, if I've thought of this, other people are so much smarter. I'm sure somebody's thought of this. And I recognized very quickly that it doesn't mean that other people are not smarter. It's just they're not focused on the thing that I may be focused on. And so it's really important for all of us to recognize that we do have leadership characteristics. We have the lens that is required for a conversation. It may just mean that we need to ask some questions. And I really encourage us all. Pharmacy technicians have saved my pharmacy practice everywhere I have been. So I value the expertise of everybody within the team, no matter your position or where you lie in the created hierarchies. But I really very much want to encourage that we ask questions to challenge the status quo and question the assumptions that we all might be making.
Thank you. There's some real key pieces of advice there to go away again and reflect on. Kate, can I ask you a question again? Research, your presentation focused a lot around the great research that you undertook. What advice would you give to pharmacy technicians around beginning that journey of research? It might not necessarily be something that the profession, some professionals feel quite comfortable with, but you've just articulated the great value that you got from it. I would just be interested in what tips of wisdom you could give colleagues.
Of course. I think if there's things that you're particularly passionate about, follow them, pursue them. I spent a few years, a long time ago, doing some voluntary work overseas across South America, and I always knew that was something I was passionate about. In that context, I was working with street children and just doing volunteer work, but I always felt like I wanted to be able to team that passion with the skills in my hand. And then an opportunity opened up to work with a medical clinic in Phuket in Cambodia. And that really set this vision of how can I use my skills within pharmacy to be part of a team that goes out and helps across the world. So that was just a passion that I had, and I was so thankful to our pharmacy department here at Adam Brooks Hospital, because they really championed me to do that. They really supported me to keep furthering my career and these opportunities. And so I was able to study alongside my full-time job, which was hard work, but it was so rewarding and so worth it. But I honestly couldn't have done it if I hadn't have been bold enough to just propose that to them. So yeah, I would say if there's anything you're passionate about, even if it feels like it doesn't quite sit in line with your job as a pharmacy technician, just see how that can link it up. Speak to the people you're working with within your pharmacy department, and they're really inspirational as well. Like, people really helped me on the journey just to be able to team those skills and that passion up. So yeah, I'd say go for it, definitely.
That's a really nice tagline, isn't it? Just go for it. Okay, thank you so much. Jill, if I may, can I just ask you, because your presentation focused a lot around collaborative leadership. And I think, again, just thinking about the importance of us growing our future pharmacy technician leaders into that kind of collaborative leadership model. Can you give any advice on areas that we may be able to develop our learning or our experiences in that particular style of leadership?
So first of all, I think just being mindful of the fact that you are a leader, and mindful of, again, whether you're in a position of authority or whether you are an individual that is practicing on a day-to-day basis, that you are recognized and you are representing your profession. So number one. Number two is mindset of looking through those skills. And again, one of my favorite leadership experts is John Maxwell. And if you had an interest in learning more about some specific skills related to growing your leadership, I would highly recommend, he's got YouTube, books, all sorts of things. I would highly recommend him as a resource for going to building upon those skills. But I think back to the mindset is that walking into your profession as this is a very important piece. The pieces of the puzzle change on an ongoing basis. Your expertise changes. And so being also mindful of educating others as to what your expertise is. I know in my experience, as I kind of alluded to, I was in pharmacy in more of an advanced clinical pharmacy role 30 plus years ago, and my parents had no idea what I did. But even my colleagues, it was sometimes a surprise about what skill sets, and with my interprofessional team, I would have to offer and educate, sometimes on repeated basis, information that occasionally would be just disregarded, occasionally would be accepted, and occasionally would have an aha moment. But it took a mindset of continuing to provide the expertise that I knew I'd been trained to provide in order to get buy-in from the team and become a part of the team. And then certainly if you have the position of authority to be really advocating and encouraging the presence of the pharmacy technicians in key areas within the pharmacist, partnering with the pharmacist. Many pharmacists don't even realize how much training is going into the pharmacy technician world today, because, you know, take somebody like me who has been practicing a while. When I first started, there was no official training. I've had the benefit of knowing this group and being educated through FIP and other organizations about the robust changes that are occurring, but making sure that your pharmacist is aware of all the changes as well.
Thank you, Jill. Again, some wise words for colleagues to take away and reflect on in terms of their own practice. I'm encouraged to see there are some questions popping in to the question and answer box. So I'm just going to ask colleagues on the call if anyone would like to answer the question around, I think most countries have the same requirement for pharmacists to be minimally a graduate in pharmacy. However, countries have different requirements for PTs. Is there any global effort to harmonise this? I'm just wondering if anyone on the panel would like to answer that particular question from an FIP perspective, or whether we will be answering the question live. Okay, in which case I'm going to hand over to, oh, Jill.
No, I was just going to say that I would probably yield it to you in regard to leadership with the Pharmacy Technician Advisory Committee within FIP, because I know that there's a great desire there. Am I not correct in regards to growing the expertise? There's always regional needs, right? And just trying to visualize the concept, right? Because the challenge of having one set standard across the board in detail is very difficult for pharmacy, as well as pharmacy technicians, right? Because every healthcare system has its unique look. And so we've had the same goals as the total professional pharmacy, but with each country, the healthcare system has its big puzzle pieces that are slightly different. And so the pharmacy profession has to fit into that. And then within pharmacy practice, there are differences. So while I would love to say that we have a standardized, and we have done a great job as far as like pharmacy education and having a global look at what pharmacy education needs to look like throughout the world, I would love to see this, but I do see some challenges in trying to get there. So Liz, I would certainly hand that back to you and to Zach and to some of the other leaders within the pharmacy technician FIP world.
Thank you, Jill. Yeah, I absolutely concur with what you said. I think that conversation about the narrative of what a pharmacy technician is within my role within the UK, I often get an email that pings in that says, can you describe what a pharmacy technician is and what they do? And I think the narrative and the language that we've been able to use in the UK is to focus very much on those educational outcomes at point of registration, which has been very helpful, but still need to require a lot of development in terms of what does that mean next, in terms of next steps of practice. But I'm going to hand over to Zach to give a view from FIP. Thank you, Zach.
Sure. Yeah, thanks. I always joke that in the United States, it's a perfect example of 50 case studies, because even the United States can't or does not come to a consensus on training pharmacy technicians. So having states that there are no two states within the United States that have identical regulations for pharmacy technicians. There's some interesting movement that allows pharmacists to delegate responsibilities to pharmacy technicians if those pharmacy technicians meet certain training requirements. And I think that's an exciting new approach. We'll see if that gains traction in other states. But I do think that it's definitely an opportunity to have some type of consensus for One, defining what a pharmacy technician does, like what is a pharmacy technician's role in pharmacy around the world, if we're coming to a global definition of what a pharmacy technician is, because it comes back to being pharmacy assistants or supportive work personnel, or, you know, all the definitions that encompass essentially what we all consider a pharmacy technician. But I think defining that role has to be solidified amongst everybody before we define what knowledge and or training is required on a global basis. Let's see, and there is a question here about career progression being limited for pharmacy technicians and how more specialization needs to be developed for emerging areas in healthcare for pharmacy technicians. So that is more of a comment to the need of a career progression for pharmacy technicians. I know, at least in my experience in the United States, the term profession as a pharmacy technician has not really been said until recent years. So it wasn't very long thought of that being a pharmacy technician was a part of the pharmacy profession, and that you could be a pharmacy technician as a career. Unfortunately, it's been said a number of times that we are just pharmacy technicians, when really we all know that that just does not need to be said. And I think, to Vibhuti's point in her presentation and the comments later, is leading without permission and then challenging that status quo to not just be pharmacy technicians. We are pharmacy technicians and part of the pharmacy profession as one. And regarding the career progression, back to defining what a pharmacy technician is capable of doing, what a pharmacy technician is responsible for. There are advanced credentials available for pharmacy technicians to earn that are in specialized areas. And I think we're at a really exciting point in the profession, because the profession has begun really recognizing pharmacy technicians for traditional roles and the advanced roles.
Zach, yeah, if I may build on that, absolutely. I think the opportunities in terms of advanced roles are never have been more exciting. I think the conversations about frameworks and building and going on into specialist areas, and the change in language that's being used, particularly around the contribution that pharmacy technicians make to better health outcomes, has never been more encouraging. And I think it's really important that we take some of the learning from today's expert speakers about making sure that we're growing our profession into the leadership positions to be able to hold those conversations and to be able to show by example what it is that we as a profession can contribute to our patients and our communities to improve healthcare.
Most definitely. I think. So there is one last question in the Q&A submission, an inquiry about a country that offers courses online for certification as a pharmacy technician. If anybody in the chat has a good resource of online learning, I don't know which country this commenter comes from, but I think that you could address that anywhere, especially if you're looking to learn or train as a pharmacy technician in very specific countries. I think it would start with being interested in a country that offers online training. So if anybody has any tips on that, if you could put them in the chat in response to this question. All right. Well, I guess if there are no more questions, I want to thank again all of our panelists, co-moderator Liz. Thank you very much. Thanks everyone for being a part of this really excellent session on leadership. Everybody's viewpoint is extremely valuable, and I hope everyone got as much from it as I did, even as moderator.